Today, we're diving into a really intense condition where one of your own organs basically turns on you. We're talking about acute pancreatitis. And this isn't just some simple inflammation. No, this is a full-on destructive battle where an organ literally wages war on itself.
So, what does this war actually feel like? Well, let me tell you, it's not your average stomachache. The pain that brings people to the hospital is unique. It's often described as boring, and that doesn't mean it's uninteresting. It means it feels like it's drilling right through your body, and it's continuous. It just doesn't let up.
So what in the world is causing that kind of pain? It's a process that sounds like something out of a horror movie, autodigestion. You see, your pancreas creates these super powerful enzymes to break down food. Normally, they only switch on when they reach your intestine, but with pancreatitis, they activate inside the pancreas. And the result? It's horrifying. The pancreas literally starts to digest itself from the inside out.
All right, so here's how we're going to break this all down. We'll look at this betrayal of the enzymes, the cascade of complications that can follow. We'll identify the main culprits, and then talk about how doctors fight this internal fire and, maybe most importantly, how to prevent it in the first place.
So let's get right into it. How does this self-destruction actually begin on a microscopic level? This is really the story of the betrayal of enzymes, how this digestive powerhouse turns against the very body it's supposed to help.
It all kicks off with some kind of trigger. These digestive enzymes get trapped inside the pancreas, and boom, they switch on way too early. There's one enzyme in particular, trypsin, that acts like a master key. Once it's active, it starts unlocking all the other destructive enzymes, and that's when the real chaos begins. First up in this, let's call it a wrecking crew, is lipase. Now, lipase's day job is to digest fat from your food. But here, inside the pancreas, it starts dissolving the organ's own fat cells. This process, called fat necrosis, releases these fatty acids that then go and bind to calcium in your blood, literally stealing it from circulation. This can cause your calcium levels to plummet, which is a really big deal for your muscles and heart.
Next on the scene is elastase. Once that master key, trypsin, turns it on, elastase goes after the elastic fibers that give your blood vessels their structure and strength. As it dissolves them, the vessels just rupture. This can cause massive internal bleeding and hemorrhage. It's incredibly dangerous. And at the same time, you've got this other enzyme, kallikreinin. This one triggers a huge widening of your blood vessels and makes them super leaky. Fluid just pours out of your bloodstream and into your tissues, causing a massive drop in blood pressure. This whole situation can spiral very quickly into life-threatening shock, where your vital organs just aren't getting the blood they need to function.
Now, you might be thinking this is just a problem with the pancreas, right? Well, that's where things get even scarier. This self-destruction doesn't stay local. The damage starts to spread, turning a problem in one organ into a full-blown, body-wide crisis.
You see, all those toxic enzymes and inflammatory chemicals from the dying pancreas, they don't stay put. They leak into the bloodstream. And once they're in circulation, they can travel anywhere, attacking distant organs and essentially spreading the fire far from where it started.
And this leads to this absolutely devastating domino effect. The lungs can fill with fluid, leading to a severe condition called ARDS. The kidneys can fail because of the shock. The circulatory system itself can collapse. And the blood can even develop this bizarre clotting problem, where you get tiny clots everywhere, while also bleeding uncontrollably. It's a total system failure.
And just to put a number on how serious this is, in severe cases, lung failure alone, that ARDS we just mentioned, is responsible for more than half of all deaths that happen within that critical first week. It's a really stark reminder of how a localized fire can quickly burn down the whole house.
Okay, so that's the devastation. The big question is, what on earth triggers this terrible cascade in the first place? Let's take a look at the main culprits.
So it turns out, while there are a lot of potential triggers, it really boils down to two big ones. Gallstones and heavy alcohol use together account for about 70% of all cases. Gallstones can physically block the pancreatic duct, and alcohol is just directly toxic to the pancreas cells.
So what about that other 30%? Well, that's where things get a bit more varied. It can be anything from direct physical trauma, to a complication from a medical procedure, to metabolic issues like sky-high triglycerides, and even certain drugs or viruses.
To really nail down the diagnosis, doctors play detective with your blood work. Every abnormal result tells a part of the story. You see elevated amylase and lipase? That just screams pancreatic cell injury. High blood sugar? That means insulin release is being impaired. And that decreased calcium? That's a huge clue pointing right back to that fat necrosis we talked about. And of course, a high white blood cell count shows the body is mounting a massive, system-wide inflammatory response.
So once the diagnosis is in, the clock is ticking. It's a full-on crisis. How in the world do medical teams fight a fire that's burning from inside the body? The entire treatment strategy, the whole playbook, is built around one single, absolutely critical principle. You have to let the pancreas rest. Stop stimulating it, give it a complete and total break.
And how do they do that? Through supportive care. The patient is made NPO, which means absolutely nothing by mouth, no food, no water, to stop the pancreas from making more enzymes. They get flooded with IV fluids to fight off shock and support their organs. They get powerful IV pain meds to manage the agony. And if they can't eat for a long time, they get nutrition through a tube or an IV line.
And you know, it's funny. Sometimes even something as simple as how you're positioned can make a huge difference. Lying flat on your back actually stretches the inflamed area and makes the pain worse. But curling up in a fetal position or sitting up and leaning forward can take the pressure off and provide some real relief.
All right, finally, let's talk about the most powerful tool of all, prevention. After seeing all the damage pancreatitis can cause, avoiding the war altogether is obviously the best strategy. And the great news is, because we know the main culprits, a lot of cases are totally preventable. It really comes down to smart lifestyle choices, avoiding heavy drinking, keeping a healthy weight to reduce your risk of gallstones, eating a low-fat diet, and getting regular exercise.
And for anyone who's recovering from an attack, you have to stay vigilant. If that intense abdominal pain comes back, or you see signs of a blockage, like yellowing skin, pale stools, or really dark urine, those are huge red flags. You need to get medical help right away.
So after all this, after seeing the destructive cascade of autodigestion and the chain reaction of complications, the most important takeaway is this. The main triggers are largely within our control, and that leaves us with a final thought. When you're facing such a devastating internal fire, prevention isn't just the best medicine, it's pretty much everything.